women move out of their childbearing years, they go through menopause, which can cause serious problems. Recognizing the signs of the condition as it approaches can help women prepare. Lurene Cachola has more.
With time comes change, and some of those changes can come when women age out of their childbearing years. Menopause is when a woman stops having periods naturally for 12 months and her ovaries stop releasing eggs.
Typically, women do start having symptoms several months, if not a year or two beforehand. The most common thing that people have is starting having some irregularity of their periods, and they can either be closer together, or what's nicer for the patient is if they are spacing out. They'll skip a month, they'll skip 2 months.
If periods are heavier, women should talk to their doctors. Tests may be necessary to make sure there's nothing else going on. There are other signs of menopause that occur within the body, some that can be very uncomfortable.
As far as the discomfort goes, the symptom that patients most complain about is hot flashes or night sweats, particularly the night sweats. If they start waking the patient up during the night, it's really hard for them to get a good night's sleep, and that then affects them the next day.
The symptoms women have as they approach menopause typically begin in the 40s and can last several years.
Usually the transition we call perimenopause is you start having symptoms, but you're still having periods, and that can usually last for several years.
Menopause also means the body stops producing estrogen, and that leads to a couple of concerns. One is that estrogen keeps bones strong, which means many women should begin taking extra calcium and vitamin D. There is another concern for women once estrogen production ends.
They then do have an increased risk of heart disease, and heart disease is the #1 killer of both men and women, but women's risk goes up after their periods have stopped.
Doctors can treat women by replacing the hormones their bodies don't naturally produce anymore. That can help alleviate some of the more annoying symptoms of menopause.
The main reason we put people on hormone replacement is to help with the worrisome hot flashes and night sweats.
There have been concerns about hormone therapy in recent years, but many doctors say the treatment has additional value beyond helping with hot flashes.
It also helps prevent against colon cancer. We know that women who are on hormones have a lower chance of having colon cancer.
So the most important thing women can do is talk to their doctor, who knows their history and their family's history, and knows symptoms to determine what the best option is for them. For Smart Medicine, I'm Lurene Cachola.